the lady sitting next to me in the airport coughed, blew her nose, and laid a crumpled tissue on top of the growing pile of snot rags. Then she looked at me and said, "I'm not contagious." I'll be honest, I've become, well, let's just say germ conscious, especially when I'm within spraying distance. So, how do you know if you're contagious? Stay tuned to find out. I'm Dr. Vickie, and this is Healthy Looks Great on You, a lifestyle medicine podcast to help you reclaim your energy, your focus, and your well-being. Life tested, doctor approved. You know those people who stop just inside the grocery store entryway, get their car, pull out a wipe, and proceed to clean the surface of their shopping cart? That would be me. Because here's the deal. Shopping cart handles are laden with infectious agents. Think about it. Snotty-nosed kids, people who didn't wash their hands after going to the bathroom, and someone who just sneezed into their hands and thinks they aren't contagious. Let's go to mini medical school and learn what contagious really means. It simply means spreading. Anger can be contagious, and so can kindness. But that's not what we're talking about. Not all illnesses are contagious, but some are. And since this is mini medical school, you need to understand that some diseases are more contagious than others. One of the most common contagious illnesses is the common cold, and maybe that's why they call it common. The most common cause is rhinovirus, but several other viruses can cause the common cold too. It's characterized by coughing, sneezing, watery or itchy eyes, and sniffling. And most people don't run a fever, so if you've heard the old adage that you aren't contagious if you aren't running a fever, then you've just learned something. Remember that for your test. According to the CDC, you're contagious a day or two before you have any symptoms, and you're most contagious those first 2 to 3 days and up to a week. They also say, and I quote, "You are generally contagious if you have symptoms like coughing, fever, or sneezing, often starting a day before symptoms appear and lasting 5 to 7 days. You are most infectious during the first 3 days of illness and should stay home until at least 24 hours after your fever breaks without medication." But now you know that most people don't run a fever with the common cold. But go by your symptoms. They're visible or audible evidence that you are spreading invisible viral particles. Allergies can mimic a cold, but allergies require a trigger. Commonly, you experience itchy eyes, nose, and throat with allergies, but you can also have that with some viruses, especially variants of COVID-19. Despite the old term hay fever, you do not run fever with allergies. Typically, allergies come on very suddenly after exposure to an allergen. Cold symptoms come on a little more slowly. At first you think, "I hope I'm not getting sick," and then you think, "I may have caught a cold," and then you are sure. Ironically, this happened to me a few days before I recorded this episode. But you've got places to go and things to do, so you think maybe you aren't contagious. You sit by someone, share your snot, and soon whatever illness you've got spreads. And that, my friends, is the very definition of contagious. And it's not just the common cold. COVID-19, influenza, parainfluenza, RSV, and a whole host of other viruses, as well as bacteria, are contagious. And they're counting on you to keep spreading them. Oh, you think you need an antibiotic so you can get well faster? Well, let's see. The common cold lasts 7 to 10 days, but the cough can last longer. Antibiotics do nothing to treat viral infections. Everything I've mentioned so far is a virus, but geez, you're sick of being sick and you have plans and responsibilities, so it wouldn't hurt to take that leftover antibiotic in your medicine cabinet, would it? We need to have a talk. Why do you have leftover antibiotics? And yes, taking antibiotics when you don't need them can cause great harm. It disrupts your gut microbiome and breeds resistance so that when you need an antibiotic, it won't work. And that probably deserves its own episode. Now, if you have a bacterial infection, then yes, you need an antibiotic, but not the leftovers. You need one that specifically targets the bacterial infection that you have. Not all antibiotics are created equal. What about a sinus infection? Contagious or not? If you truly have a sinus infection, it isn't contagious, but the virus that started it often is. Because most sinus infections start out with a viral illness that is contagious. If you've only been sick 3 to 4 days and really less than 10, you're probably contagious. Sinus infections are characterized by pain and pressure, a headache, and even bad breath and a fever. And sinus infections can be either viral or bacterial. Did you say something? I can barely hear you. Oh, you have laryngitis, but it's not contagious? Unless you've been singing your heart out or yelling at your favorite basketball team in March Madness, your laryngitis is most likely from a virus and is most likely contagious. Thanks for sharing. Now, you've developed a cough and you've been diagnosed with bronchitis. Hopefully, you're seeing a pattern now and you aren't going to try to convince me you aren't contagious, are you? You can try and convince me that ain't nobody got time for that. But most cases of acute bronchitis are caused by viruses, not bacteria. That means that antibiotics usually don't help at all. Now, smokers and people with reactive airway disease can certainly have a cough that is not contagious. But if all of a sudden you're tired and hacking, you've probably got viral contagious bronchitis. And even when bacteria are involved, antibiotics are only helpful in specific situations. No, not the leftover ones. Now let's go back to the grocery store and all those germs on the handle. We got a little rhinovirus and some COVID-19, stomach bugs, ugh, and respiratory syncytial virus. You probably know it by its nickname, RSV. Now, when I was delivering babies and making rounds in the hospital on a daily basis, the pediatric unit would predictably fill up in January with RSV babies. January, not May, not September, but January. And when I say the unit was full, I am not exaggerating. And then a couple of things happened. The pandemic guidelines to wear a mask, wash our hands, socially distance, and stay at home when sick seemed to screw up the predictability of RSV. And all of a sudden, when the mask mandates were lifted, RSV made a comeback. And now you hear about it year round. It's spread by droplets, coughing, sneezing, kissing, and touching people or toys or the grocery cart handle. And most people are contagious for about a week, but infants and some vulnerable people can shed virus for several weeks. So it was a game changer when there was a vaccine developed in 2023. And those of us over 60 were approved first. You know, grandparents. Because now that we understand what contagious means and how serious RSV is for our little grandbabies, we want to do everything we can to protect them. Not only that, but RSV can make older adults really sick too. Pregnant women can receive the RSV vaccine between 32 and 36 weeks of pregnancy. And this allows antibodies to cross the placenta and protect the newborn for about the first 6 months of life, which is when RSV risk is highest. Or babies can get a shot of long-acting monoclonal antibodies in the first 8 months of life. And both of these significantly reduce RSV hospitalizations for babies. Now, no discussion about contagious upper respiratory infections would be complete without mentioning COVID-19. It's hard to believe it's been 6 years since the worldwide pandemic was declared. I'll be honest, I'm still a little traumatized by the discrepancy of what I saw with my own eyes, doctors, nurses, respiratory therapists, and those of us in hospital administration working night and day to try to treat a rapidly evolving virus versus emotional proclamations from people and sometimes even clinic doctors who did not don hazmat gear every day to do their job. Sorry, not sorry. Medical school doesn't really prepare you for some of the losses you witness, and many medical school can actually make you dangerous. So if you weren't there, maybe sit this one out. The weird thing about COVID 19 is symptoms can vary or even be absent. One reason COVID spreads so easily is that it travels through tiny particles that can linger in the air, making it highly contagious. COVID 19 is airborne. Those are the most dangerous viruses, like measles. It's one of the most contagious diseases in the world, with a row of 12 to 18. Did I see a hand in the back? What's your question? What is row? Excellent question. That's RO, and it's very important for you to learn. If row is 12 to 18, then a single person with measles can transmit the virus to 12 to 18 susceptible people. So when we talk about contagious viral illnesses, that's next level. Now, that number only refers to susceptible people. Vaccination is protective, but here's the deal. Kids are first vaccinated with the MMR at 12 to 15 months, and then the second shot between 4 and 6 years. Here's an excerpt from an interview I did with Dr. Chad Masters, a pediatrician I trust.
There have been outbreaks from time to time, but I've never seen a case of measles in my 10 plus years of practice. So everything I know about measles comes secondhand from these other providers who have seen it. But we just didn't see a lot of measles because of the vaccine rate. Most everyone was getting their MMR vaccine, and that protected those people who couldn't for whatever reason. But now that we're seeing an increased rate of people not getting their MMR as scheduled, and so we have a higher unvaccinated population, which has allowed these outbreaks to explode in certain areas.
So I have two grandsons, and one of them's 5, one of them's 2. I don't keep up with their vaccine schedules. They get them when the pediatrician tells them to get them. But are they fully protected if they're around someone who is contagious with measles?
The 5-year-old would have both sets of the MMR, one at year one and one at year four, would be what they say 97% protected against the measles. By and large, we would consider them immune. The 2-year-old would have had one MMR vaccine following the normal schedule, and that provides 93% protection according to the data that we have. And so, mostly protected, but not as protected as if they would have had that second dose, which, if they're in an outbreak setting, they can get early and it count for their second MMR vaccination.
Good to know. I did not even realize it was as high as 93% with one
One, yes.
dose. So that's very reassuring to me. Not long ago, after I wiped down my grocery cart, I headed to the produce aisle because fruits and veggies support your immune system. They don't make you immune, but they definitely improve health. And I grabbed one of those thin plastic bags and rubbed it between my fingers, but couldn't get the edges apart. Ugh, so frustrating. And a man was standing by the tomatoes and said, "Let me show you a little secret. Here's what I do." And he proceeded to show me how to open the bag. He licked his fingers. And I should have been polite and said thank you, but the words just fell out of my mouth. I would never do that. There are germs on my fingers. Now, that was rude. He was trying to help, and that's the thing. People share memes and headlines because they want to spread helpful information. But if you aren't very, very careful, you'll spread more than germs, and misinformation can be every bit as dangerous. Here's a life hack. Moisture on your fingers does make opening those flimsy bags a lot easier. But instead of licking your fingers and potentially infecting yourself with something contagious, head over to broccoli. It holds the water droplets from the mister, and you can touch the broccoli and open the bag. And better yet, take the broccoli home. Wash it thoroughly and eat it. It's packed with vitamins and fiber and antioxidants that support your immune system. If you remember nothing else from today's episode, remember the 3 clues that you might be contagious. You have respiratory symptoms like cough, sneeze, sore throat, runny nose. Your illness just started, those first few days are the most contagious, and someone around you is also sick. If those 3 things are true, congratulations, you're probably sharing germs. And there's a lot going around right now. And one of the big reasons viruses make the rounds is because you are contagious. So wipe your cart, eat your veggies, and don't share your germs. That keeps us all healthy, and healthy looks great on you. If you found today's episode helpful, would you share it with a friend and invite them to follow along? Go to healthylooksgreatonyou.com and sign up to get my weekly newsletter.
The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.